everybody out there. Today I want to talk about my journey with thyroid cancer and how I got diagnosed, how many doctors I went to that misdiagnosed me, how our healthcare system is so whacked here in America. I met with so many incompetent doctors, and I praise nurse practitioners because without this one special lady, she saved my life. And my journey starts about 3 years ago. I had developed shingles along my neck, and my blood count, my platelets were low. So I was referred by a GP to go see a hematologist, oncologist. And this man, I'll call him Dr. J, well actually it should be Dr. Jackass, he just looked at my blood work. At the time I also had a goiter. He looked at the shingles and he goes, "What's this?" And I'm like, "I don't know, you're the doctor." And he had no diagnosis, didn't take the goiter into consideration. But what he did do, because I was alone in the room, is instead of saying, "Miss, do you mind if I give you a breast exam for breast cancer?" He just went bam and squeezed my boobs. And I was just in shock. And so that was my dealing with this jackass. And so a couple doctors down the road I went to, they treated me for shingles. They saw the goiters and the lump. I had lumps on my neck. They totally ignored them. "Oh, that's not cancer, that's not serious." They didn't, want to do a biopsy. So finally, my shingles flared up again, and the goiter got a bit larger. So I went to an immediate care clinic, and this woman was a nurse practitioner, and she noticed the goiter. She successfully treated the shingles, and she logged into the computer system and noticed that on my last blood test that my TSH levels were so off that she ordered more test scans. And about a few days later I got a phone call from her saying, "You have thyroid cancer," and she gave me the proper procedures, who to see. I met with this great oncologist, great surgeons, and I had a thyroidectomy, which was not fun because there was a lot of cancer in my neck, and it went from here all the way up to here. And I have a scar, but I don't mind because I'm alive. But once they got in and they did more scans, they noticed that I had a tumor in my sternum, and so the cancer had metastasized, and it spread to my lymph nodes, and it was 4A, stage 4A. So after I healed from my thyroidectomy, they had to basically crack my sternum open and do kind of an open heart procedure, as you can see. I'm not trying to flash my boobs, but showing my scar. But that was a nightmare. I was in the hospital for 30 days. They had to transport me to a second hospital for another surgery. There were complications. I basically was tied to a bed with all this equipment because my lymph fluid was draining so much. There was attached to me, and I was basically just strapped to the bed for 30 days. And, I had to have constant help, and for me, I'm like a monkey. I like to move around, and for me to be like paralyzed almost on the bed, it was just torture. And the doctor, he was a great doctor, and I knew he had to do what he had to do, but he put me on this diet of peppermints. I could only have a peppermint and ice for about 3 weeks. And of course they gave me a supplemental nutrition through the IV. But it was pure hell. And then my mom was with me one night, and I was complaining of pain in my lungs, and the nurse wasn't taking me seriously, thinking I'm trying to get more pain meds, and she was a bitch. And finally, I was just almost unconscious, and my mom ran out, and luckily, she, alerted the nurse's station, and luckily the doctor, my surgeon, was there for an emergency surgery on another patient, and he was on the floor, and my mom told him what was going on. He ran in, and he saw it. He had to do the procedure right there. There was blood in my lungs, and it was a nightmare. And I remember Halloween. I was in there on Halloween, and I'm like, yeah, I'm in the right place, because I'm in the middle of a nightmare. But I was there for 30 days, and I eventually got out. And they always say if you make it to the 5-year mark, you're good. And I made it to 2.5 years, because last year I had noticed I had some spots on my neck, and I showed one of my surgeons who did the initial thyroidectomy. I showed my oncologist. None of these doctors took me seriously. They said, that's scar tissue. They wouldn't conduct a biopsy. Finally, I got one of the doctors to conduct the biopsy. That was another issue. It got lost. The disc got lost. I had other issues with this oncologist. I left his practice, and finally I got the proper help. They did a biopsy, and sure enough, it was cancer came back. And I had surgery last fall, and I was so pissed off because I was like, I couldn't even make it to that 5-year mark. And so what happened was, they told me I had to do the radioactive iodine, and so that I did that, and so far everything's good, but it just leaves me jumpy and nervous. Will it come back? And I try to stay positive. And part of the reason why I want to share my story is with other people. If you feel a lump or a goiter, please get help. And if doctors, they're human. I'm not totally disrespecting the medical community, but they make mistakes, and they're not all experts, and they're not gods. So please get second opinions, and if not a second opinion, get a third opinion, get a fourth opinion, because you know your body, and if you know something's not right, please just keep going if you can. And so that's where I am right now. And another thing about when your thyroid's off, my thyroid's level, my TSHs are off right now, so I've gained a lot of weight. But I'm working on that with my doctor to get them right, and a proper diet and exercise. But I lost a lot of weight when I was first diagnosed. And if you're losing a lot of weight, acting erratically, I would call it, because a lot of thyroid disorders can be considered in the mental health community as bipolar. You could be diagnosed as bipolar because what people don't realize is the mental effects of your thyroid being off. And you can have just your mood changes, dramatic mood swings, bitchiness, restlessness, racing thoughts, behavior that's not usually your own normal behavior. And so if you're having, these symptoms, I'm just here to spread the awareness. If you feel the lumps in your neck. And, don't let anybody, tell you that, oh, don't worry about it, because it's your life. And life is beautiful, and we all want to live. And you gotta fight. You gotta fight for your life. And only you can do it. So, more power to everybody. And I want everybody to be healthy. And not only for thyroid cancer, for any type of cancer. I met so many people at the oncology places who had brain cancer, breast cancer, all kinds, lung cancer, every type. And these people were wonderful, the strength, but if you feel anything off in your body and people are saying, no, you don't have that, keep going. You might be okay, and I hope everybody's okay, but I just want to spread this awareness, and thank you. If you're listening, I really appreciate it, and God bless you. And right now, it's 80 degrees here in Northwest Indiana. I'm living in the region outside Chicago. I'm only like 30 minutes outside Chicago. And go Cubs. And everybody, take care of yourself. Peace.